Hello everyone, welcome to my channel Ravi Static Physio. So in the series of medical physiotherapy's laws and ethics, so next topic is obtaining an informed consent. So what is that and how you can write in university examination? So let's brief about that. So what is the informed consent? It is the procedure of towards the patient or therapist before the start the treatment procedure. So patient have to be signed into the consent form and therapist have to take a counseling and advice about the treatment procedure. So informed consent is a process where healthcare professionals educate the patient about the risk, benefits and alternatives of the medical procedure or the treatment, empowering them to make autonomous decision about their care is a legal, ethical and professional requirement. So patients have voluntariness about the treatment procedure and have to be right to choose their alternatives or also their risk and benefits aware about that. So there is a types of informed consent into the medical departments. First is written. So it is a formal document signed by the patient. It's very essential before starting any procedure of the treatment. Next would be verbal. Verbal consent is mandatory, but make sure there is no any kind of future like medical legal cases symptoms arise in your side. A decision of the agreement between the patient and provider into the verbally. Next is to be electronic. The consent given through an online platform. So patient have to fill the form into the online, and after that there is a digital sign over there, and after that it will be procedure of the treatment will be started into the offline mode. Next is to be implied. The consent that inferred from the patient action and behavior. So it will be a patient have not at like to be a sign over there, and there is have no attender. So therapists have to be talk about the senior authority and there have to be signed so that start the further procedure of the treatment. Next is to be steps of obtain informed consent. So the methods of action involves example surgery, medication, data collection. So these are the action involved in written in the informed consent, and also that expect the duration of any follow-up requirements use a single non-technical language tailored to the individual's levels to understanding the ensure their grasp and what will happen. So explain the whole procedure of the patient regarding the treatment, regarding the alternatives, regarding the risk, regarding the benefits, regarding the potential hazards. And after that, the patient have to be assured and understand. So also the grasp all of the things. So after that, you have to start the treatment procedure. Second is to be discussion of risk and benefits. Inform the individual about the potential risk and benefits. You have to share such information about the like in physiotherapy, manipulation and mobilization for the risk or also benefits into the electronic or electrotherapy. You have to share like risk or benefits or also alternatives. Risk highlight possible side effects, complication or discomfort, example pain, infection, uncertainty in procedure outcome. So you have to be highlight what kind of treatment procedure and what kind of arising like pain or like refer pain. It will be like peripheralization of the pain or like centralization of the pain. You have to highlight into the informed consent or also share the such information about the towards the patient. Next is to be benefits. So what is the discussion about the risk and benefits? It explains the potential positive outcomes such as improved health and contributing the scientific knowledge. So share such information towards the patient, so it will be enhance the therapist patient relationship and also enhance the healthcare, contributing the scientific knowledge. The purpose to allow the individual to know about the conditional treatment. So patient have know about that what kind of treatment procedure have to be started towards the therapist on them. Next is to be alternatives. Outline any alternative option available, example treatment procedure or choice to do nothing, including the implication if not participating. Why it is matter that ensure the individual can make a fully informed decision by comparing all possible paths. So if the patient have to be like a choose alternatives, so you have to know a force to him like not you not choose that kind of alternatives. You have no right towards that manipulate the patient like mind, and they'll have to be not a play to psychologically with the patient. So the patient have to choose alternatives, so you have to be like fully like voluntariness to right to choose over the patient participation. So it is matter to ensure the individual make their fully informed decision. So voluntary participation emphasize the participation for entire voluntary. The individual can refuse without any consequence. So you have not forced towards the patient. You have to should choose this method of the treatment procedure. There is you have to no right to like your treatment procedure, your electronic gadgets. So you have to be only for the advice, not like to be you can choose only for them. So patient have to be voluntariness about that. Either it will be choose or either it will be refuse them. Next is to be in alternatives, they can withdraw and anytime even after initially agreeing. So patient have to be right, they can deny during the treatment procedure, before the treatment procedure. If any kind of thing potential hazard, they have to be shown. Communication, make the explicit to avoid any perception of pressure. So you have to be convey your message or like advice to you what is the benefit about the treatment procedure. So patient have to be relaxed and communicate with you and start do not interrupt you during the treatment procedure. Next is to be opportunity to ask question. Encourage the individual to ask question and provide clear answer. And approach, create an open supportive environment there where they'll feel comfortable raising concern, addressing any uncertainties to ensure they have all the information they need. So you have to encourage the patient to raise the question about the treatment procedure, regarding the electronic devices, regarding the procedure of the treatment, step of the treatment, any kind of alternatives, potential hazards, benefits, and also the you have to be provide such environment where patient have to be fully can do the have to be there have to be environment, supportive environment, raising their concern. Next is to be assessing comprehension. After the informed consent, explain it is essential to assess participant understanding of the information provided. This can be done through open-ended question or quick quizzes to gauge the retention of a quick concept such as risk and benefits of the participant. If there is a confusion, repeat or clarify of information until the comprehension is to be achieved. So you have to be assess the patient, either it will be understand or not understand about the treatment procedure. You have to be in between the treatment procedure or before the treatment procedure. You have to be asked some quizzes arise from the patient side to ask me as a therapist if there is any kind of query, if any kinds of question regarding the treatment procedure, regarding the electronic devices, regarding the pain relief management, all of the confusion. You have to be patient ask towards the patient, or any kind of confusion patient ask repeat again and again, and you have to be share information by yourself until the comprehension is to be achieved by the patient. So that is the obtain consent. You have to write university examination for good marks. Thank you.